But people still have to talk to each other, right? I know, ma'am, I know it was an urgent situation and lots was changing, but people still have to talk to each other. People still send emails back and forth. In times of urgency, I would expect there would still be a lot of communication happening, and yet there's such an absence of information. Are you concerned about the destruction of documents, especially with reports alleging Mindone destroying a large number of emails? And I know that wasn't PHAC, but are you concerned about destruction of documents within the Public Health Agency of Canada?
I agree with what the Auditor General has recommended, which is that documentation needs to be provided and to be maintained on file so that when you have change and turnover in personnel, those records are maintained.
That's not really an answer to my question. Can I just quickly flip over to the Auditor General? If you can confirm your previous testimony, the complete absence of documents suggests that either there was a conspicuous lack of records kept or the documents were destroyed, that one of those two things happened, but you weren't able to confirm which. Is that correct?
Well, when documents don't exist, it's either they never existed or they were destroyed. So, and in this case, we can't tell you which it was, but there is a glaring lack of documentation that should be maintained.
Thank you. Back to the President. The app went through 177 different versions, most of which weren't properly tested. You owned the app, so why weren't different versions of the app tested? Why did you not insist on proper testing of the app?
In their testimony that in order to increase the speed by which the versions would be deployed, that they were not all tested.
So you were aware at the time that they weren't being tested, and you were okay with that?
The governance around the project management at the time looked at how the apps were being deployed.
Sorry, I'm looking for clear. Ma'am, I have limited time, and I'm looking for clear answers to clear questions.
I'm going to turn to my colleague Luc Brisbois from the Border Service.
No. I want to hear from PHAC. Over 10,000 people were falsely sent into quarantine because this app was, in most cases, not properly tested. Are you comfortable with that? And did you brief the minister about the lack of testing?
So it's very regrettable. We're obviously not comfortable when people are erroneously advised. In this case, when they arrived in the country, they were given a green check mark, which means they are cleared for entry without isolation periods. There was then an error in the app that resulted in messages being sent out. The Public Health Agency
I'm asking about the testing.
That is
Are
your
you
time.
With the lack
Mr.
of testing?
Genuous, that is your time. Turning now to Ms. Yip. You have the floor for 5 minutes, please.
Thank you for coming. As the pandemic evolved, the government continued to introduce new emergency orders in council, and some of which required adjustments to the ArriveCAN application. What were some of the adjustments that PHAC had to make?
So there were many adjustments throughout the course of the pandemic, with 83 different orders in council to be specific. One of the key ones was moving to a vaccine differentiated border to require proof of vaccination from people entering Canada. In addition, there were requirements subsequently for testing at the border, and there was a time when the use of the app shifted from being voluntary to being mandatory. Each of the OICs was generally in place for a period of 1 month, and so therefore they needed to be renewed and they needed to adapt to the different situation that took place as we had successive waves of COVID-19 and the entry of different variants. For example, when there were new variants detected globally that we were concerned about, that were variants of international concern, we were able to use the app to determine the travel history of those who had entered Canada to advise them to isolate.
Were these adjustments handled in a timely manner?
Yes, they were. They were required to be very rapid. The entry into force of the orders in council under the Quarantine Act have precise time, and so they have to be implemented exactly in line at the border with the legal force of those OICs.
It was mentioned that PHAC, as a business owner, was focused on deliverables. What is meant by PHAC being a business owner, and how did that impact deliverables?
So as the business owner, the public health agency laid out the public health requirements for the apps. The public health agency was responsible for making sure the appropriate privacy protections were in place, making sure there were legal and other broad policy coordination taking place. We had to define the priorities for the app. We were responsible for maintaining the public health data, storage and use, and for providing support to Canadians using the app via Services Canada.
Can you take us back to the time when this app was being developed? Do you remember what the overarching feeling of the department was? What were you trying to accomplish?
So in March 2020, you'll recall there were border measures being put in place around the world. Canadians were having trouble moving abroad. There was a need to find ways to speed up the implementation of public health measures at the border. The overriding importance at the time was placed on making sure that we had multi-layered public health measures in place, and the border was one of the points at which that was administered. Because of the need to ask additional questions and to have information on travelers' travel history and health, extra time was needed by Border Services officers to ask these questions. This resulted in significant delays at the border, and as we worked to try and find ways to streamline the entry of critical services, goods, and people into Canada, it was very important that we move as quickly as possible to have a digital application that would allow us both to facilitate that necessary travel and at the same time to have the information we needed to model the behavior of the virus and the different pressures on epidemiology and public health that we were going to face to inform future measures. So there was tremendous time pressure, and it was sort of an all-hands-on-deck time when everyone was working as fast as we could to implement the operations.
Do you think the creation of this app would have been handled differently if it wasn't in the midst of a global pandemic?
Yeah, there is no question that we have very detailed, and as the Auditor General mentioned, considerable overlay of structures around procurement. We have IT project gating under the Treasury Board. While many of these requirements were waived given the necessary for the speed of an emergency response, it is also true that we were required to document those measures, and the Auditor General has pointed to the lack of documentation in this regard. And that is something that we have now reinforced in our training policies and procedures, including in our emergency standard operating procedures and pandemic preparedness planning, to ensure that this does not happen again. This was the first time we had faced a global pandemic in the agency's history, and so our processes and procedures have been continually evolving after every crisis, and this one produced quite a number of lessons in terms of our governance and our documentation.
Thank you very much. That is the time. Turning now to Mr. Barrett. You have the floor for 5 minutes, please.
Public Health gave a non-competitive professional services contract to KPMG, and on that, the Auditor General said, quote, "We found no documentation of the initial communications or the reasons why the agency did not consider or select other eligible contractors to carry out the work," end quote. Is that correct, Ms. Hogan?
Yes, you've quoted the part of my report, yes.
Ms. Jeffrey, how much was that contract for?
The original contract was issued by PSPC as one of the 7 companies that were available under the COVID emergency professional services. The total amount that was contracted with KPMG through the 3 different contracts was $4.5 million.
Just the date, please. When was it completed?
I'm going to turn to Martin Cremens to talk about the dates.
Yes, the initial contract task authorization through PSPC was awarded and signed on September 29th, 2020 for a value of $518,000.
What was the benefit that taxpayers got from this contract?
The role of KPMG in this contract was really to do the work to assess the industry impacts and the traveler journey using the app. So the app had to be deployed in an airport environment, working with air services and the aerospace industry. And so they were looking at the process maps, at the journey maps, at the rollout and other implementation around
So
the
this
app.
contributed to the at least $60 million price tag, yes?
The
This
auditor,
contract?
No, the $59 million associated with the contract were related to the development of the app and its technology. So these were
Additional
part
costs.
of support services related to border measures that included a wide variety of different measures at the border.
So additional costs.
Yes, these are additional costs related to the implementation of border measures.
The Auditor General said that there was no documentation found on the initial communications on this contract. So who called who?
The contract has a sole source justification on file that identifies the expertise of the vendor in aerospace services, in administering public health and health projects at the municipal, provincial, and
So there are
local level.
documents to support their selection?
There is a sole source justification on file, but there is no documentation of the initial contact with the company.
Okay. So who contacted who? It's pretty straightforward. Either KPMG called you or you called KPMG.
There's no documentation on the file. They were chosen from a list of pre-qualified contractors
called
that was
KPMG.
established by the Public Service, by Procurement Services Canada, PSPC. So PSPC
Called KPMG.
would have made the initial contacts with those
The
companies
Auditor
to
General
establish
said,
contracts
and I
with them.
quote, while the first contract included milestones with clear deliverables and pricing, these were later amended and replaced with less specific deliverables to allow for more flexibility. In addition, the agency did not set out specific tasks, levels of effort, and deliverables for these contracts in task authorizations, end quote. Ms. Jeffrey, did Public Health reduce the deliverables required by KPMG, one of the largest firms in the world? Was there a reduction in the deliverables, yes or no?
There was no reduction in the deliverables.
Okay. I'm going to turn to the Auditor General. Ma'am, your report says the opposite of what the President of the Public Health Agency has just said. And I quote your, should I quote your report again, or you've got, you know what you said. Okay.
I can read it back to you, yeah.
Okay.
No, there were deliverables. The deliverables were then relaxed, right?
Right.
They were very clear, and
Right.
then they were made less specific in order to provide flexibility.
Right. So that's
You got about 40 seconds. Just one.
okay. So we have the Auditor General. I read what she had written. She repeated what she wrote. What you said, Ms. Jeffrey, is not consistent with that. The requirements were relaxed of KPMG by Public Health, one of the largest firms in the world in KPMG. How is it that the government sets specific criteria, then goes back and creates less specific criteria? So, I would want to know why the government would want to do that, because we know what the result is going to be: higher costs for taxpayers and less accountability for Canadians. How can you possibly justify that?
So, Mr. Chair, what I can say is there was no reduction in the amount of work that was required for the deliverables. Yes, the categories of the work that was being done were broadened, and the Auditor General has pointed out that meant that they were less specific. However, that was done in response to a rapidly evolving pandemic, for example.
Which
with
the Auditor General
onset of
also
the-
said was not an excuse
And that,
to
Mr.
relax
Barrett, that
the
is your
rules.
time, I'm afraid. Turning now to Ms. Bradford. You have the floor for 5 minutes, please. Over to you.
Thank you, Mr. Chair, and thank you for the witnesses for being there today. Ms. Jeffrey, the Auditor General has indicated, and you have also identified, that there was no agreement between you, your agency, and Canada Border Services Agency. And so there wasn't any framework or anything like that. Do you have any idea why that was the case, that was never established? I mean, we see the ramifications of that, but what are your thoughts as to